Communication is the exchange of information between the sender and the receiver. Communication includes understanding, talking, reading, and writing. A person with autism may have challenges such as understanding and using gestures like pointing or waving, understanding and using words, following directions, learning to read or write. Some children with autism may read, but they will not be able to understand what they are reading, and having conversations. A person with autism may also lose words, be hard to understand, and repeat words or phrases that are heard, and use a robotic or sing-song speaking voice, talk very little or not at all, even though they have a good language comprehension, using challenging behaviors instead of talking when they are not able to use words or sentences. Children with ASD are often self-absorbed and seem to exist in their own private world in which they have limited ability to successfully communicate and interact with others. They may have difficulty developing language skills and understanding what others say to them. Poor or no imitation skills are a challenge to developing meaningful communication. Auditory, visual, tactile, sensory, perceptual difficulties also add to their communication difficulties. The communication difficulties also is contributed to the lack of executive functioning. Generally, a child who exhibits a developmental delay follows a progression of development found in general population, but at a slower pace than the general population. In contrast, a child who exhibits deviance follows a different method of progression for development in compared to general population. There is evidence that children with autism may show both delayed and deviant developmental progression. In many children with autism, language development is often delayed but occurs in the progression similar to that of other neurotypical children. But in others, they follow a deviant developmental pattern wherein they repeat the words that are heard, example echolalia. Many children also demonstrate deviance in the development of social and pragmatic skills. Regression refers to the losing of skills, losing of words that they have once attained, and they stop using them later on, and they also sometimes stop looking at faces that once they have been looking at, and this same way of regression is also noticed in certain other social behaviors as well. So these are also considered as regression in speech, social pragmatic communication, also seen as a red flag for autism. They lose these skills once they gain these skills, and they lose these skills during the preschool period, and even we can see a slow progression in regression, that is they start losing their skills right from infancy subtly, so that we notice only during the preschool period. Studies also suggest that regression may actually be part of a continuum of atypical development that begins earlier and more subtly in infancy. The ability of children with autism to communicate and use language depends on their intellectual and social development. Some children with autism spectrum disorder may not be able to communicate using speech or language, and some may have very limited speaking skills. Others may have rich vocabulary and be able to talk about specific topics of their interest, and they keep on going on talking about their topic of interest. Now let's take a look at the differences in the communication pattern of an individual with autism. Restricted or repetitive or rigid language, that is often children with ASD can speak well, say things that have no meaning or they do not relate to the context. That is, for example, when we are talking about something else, the child with autism may speak about numbers which is not at all related to the context that is being talked about. Narrow interest and exceptional abilities. Some children may have in-depth knowledge about some topic and they will be fond of talking about that topic and listening to talks about that topic, etc. And they may, even though they may not be able to carry out a two-way conversation about the same topic. Usually it will be a monologue. Approximately 10% of children with ASD show savant skills. That is, we have heard children repeating the calendar, saying the day or the date or the month. When we are saying a particular date, they are able to say the month or the day, which is the day, etc. So these kind of savant abilities, they are able to memorize, they are able to calculate, they have special abilities in music, maths, etc. Many children with ASD develop some speech and language skills, but not to a normal level of ability, and their progress is usually uneven. For example, they may develop a strong vocabulary in a particular area of interest and very quickly. Poor nonverbal conversation skills. Children with ASD are often unable to use gestures, such as they won't be able to point, they won't be able to understand what we are pointing at, they won't be able to understand the gestures that we show with eye gaze to show that somebody is standing there or something is there. We look at them and look at the people or the object, they are not able to understand. They avoid eye contact, they are not fond of looking at people's faces, and which make them seem uninterested and inattentive. Echolalia describes the repetition or echoing aloud of words and sounds. Repetitive speech is an extremely common part of language development and is commonly seen in young toddlers. But in young toddlers, that disappear in a short span of time. But in children with language delay, speech and language delay, it persists. So in children with autism, we can often see the characteristic of speech, that is echolalia. They are repeating whatever is told to them, and we can get them treated with by consulting a speech language pathologist. Echolalia can be immediate or delayed. Immediate echolalia happens when the child is repeating immediately. That is, when you are saying, what is your name? The child will repeat, what is your name? That's how immediate echolalia happens. But delayed echolalia may be sometimes functional. It has some function for the child. So delayed echolalia happens when the child is asking for it's circle time, it's circle time. So what he means is he wants some rhyme that was sung during the circle time by his teacher. He wants to listen to that rhyme. That is what he is meaning. But he is saying that it's circle time, it's circle time. So that is delayed echolalia. While it might be difficult to figure out what a child is trying to say when he or she uses echolalia, learning a little bit about this type of speech can help you figure out the meaning behind his or her message. Here are a few points you need to know about echolalia. Children with echolalia, with autism spectrum disorder, use echolalia because they learn language differently. Typically, developing children tend to begin learning language by first understanding and using single words, and then gradually string them together to phrases and sentences. But children with ASD sometimes understand language as chunks. They are not able to divide it into different words or sentences. That is, if they are saying it's not time for dinner, so they are not able to. They have heard some word from it's not time for dinner, but they are repeating it again and again, but they are not able to figure it out. It's not time, dinner, etc. are different words. Also, the child, whenever the child sees his father filling the bathtub, may say it's time for bath, it's time for your bath. So he is meaning he wants to bath maybe, and he is not able to figure it out. It's different words, and it is a whole sentence, and it has a meaning. And characteristics of echolalia. Echolalia often has a purpose or a message. That is, the children echoing, we often take it as they are just echoing. No, it's not just echoing. They have some meaning associated with the echolalia, such as they may ask for things, they may narrate about the past events or experience that they had. They may be asking, like, do you want a cookie? The child may ask. That means he wants a cookie. So he have heard that people are asking, do you want a cookie? Do you want a cookie to him every time they give him a cookie. So he understands that he has to ask, do you want a cookie for a cookie? So That means every time echolalia has some meaning associated with it, unless until it is just a verbal stereotype. The child is just trimming words with words or sentences. Then to start an interaction or keep it going, that is, are you ready or not? The child is always asking, are you ready or not? Are you ready or not? This means he wants the whatever activity is going on has to be going on, or he has to start with some game that he has experienced sometime. And also to draw someone's attention to something, that is like, it's Superman, it's Spider-Man, look, it's a bird. So he is saying that when there is no bird, no Superman, no nothing associated with it. So what he means is there is something that needs your attention that he is interested in. Then to protest something, I don't want this, I don't want your pants, I don't want your pants, or I don't want to wear those pants. He is keeping on saying that, or I don't want you to wear those pants. That means he doesn't want to wear the pants. He is just giving that pronoun reversal, like you for I. So when this happens when the mother is asking him to wear another pant or change his pants. So and also to answer yes. Sometimes he may say, do you want your yogurt? When mom is asking, do you want yogurt? He may answer, do you want yogurt? That means he really wants yogurt. He's not asking the mother, do you want yogurt? He is saying a yes there. And a child with echolalia can be helped. So we can always help these children who are echoing. So they can be helped by looking for clues that let you know the meaning behind your child's message. In order to do this, you will need to follow your child's lead. So how can we follow the child's lead? Observing your child and his interest. That is, in order to figure out what he is trying to say. Is he trying to give an yes, or is he trying to say about something of his interest, or does he want some play of his interest or some rhyme of his interest? So in order to figure out, we should know what the child likes. Is it an answer to a question? So what is the context he is telling? All this we have to be clear about. Then listening carefully to what he says. So just give your ears to your child. Just listen to what he is echoing. So you will understand the context somewhere you might have experienced with your child. So he wants the same rhyme or something that was funny or interesting for him there. So that can be. So you have to listen carefully, waiting without talking. Let your child echo, and your child itself may echo and lead you, push you or pull you to somewhere, so that you get the idea, yeah, this is what he meant. So you can wait patiently to your child's gestures and echo. And once you have figured out the meaning behind your child's echolalia, you are ready to respond in a way that will help him learn. This means you will need to be your child's interpreter. You should understand your child's interest and his activities. So interpreting your child's echolalia involves saying it for him as he would if he could. That is, in a proper manner. If he is saying, do you want yogurt? You can just repeat as I want yogurt, and give him yogurt. So he gets the idea how it has to be, words has to be arranged. Giving your child an exact model he can learn from you. That is, whenever he is echoing, just give him a model of the communication context, the words to be used, the structure of the sentence, and then get him whatever he wants to be done. And interpreting a child who uses echolalia means saying it exactly as he would if he could. Sometimes you might need to use the word I for me. Usually there will be pronoun reversals, like your child may use you instead of I or me, and you can just repeat the sentence putting the correct pronoun for your child. And echolalia can be a hindrance in daily life, but it's not wise to just erase out echolalia or just keep your child or prohibit your child from echoing. So we have to figure out the meaning, listen to what the child is saying, and just give him the possible ways that he can develop his language so that his echoing reduces. A speech language pathologist can help with treatment and management of communication difficulties in individuals with autism spectrum disorder. Some Sometimes alternative augmentative communication strategies may be implemented to initiate a proper development of communication in non-verbal or minimally verbal individuals. Research clearly states that learning experiences during the first 3 years of a child's life are pivotal for later brain development. Early communication intervention that incorporate augmentative alternative communication can aid intentional communication behaviors in children. According to research, access to augmentative alternative communication beginning at 16 months of age has been found to benefit children with disabilities such as autism. There are certain myths that people think or believe that refrain them from using alternative augmentative communication. So we can just have a look at few of them. So parents usually think my child is too young for AAC. No, there is nothing like too young for AAC. You can start AAC at the earliest, because from the day one your child starts communicating in one way or the other, and as your child grows he has more and more needs for communication. So as soon as the child is ready for good communication, like we saw at 16 months or so we have started, so we can start at the earliest. And it can also increase vocabulary for children who are 3 years old and younger. Using AAC will prevent my child from talking. Few parents think so that if we use AACs, the child will not talk later. No, usually AAC helps children to talk. Minimally verbal children sometimes may be more verbal and they may talk in sentences, etc. After using AAC. So AAC usually aids in developing the language for children, but always not necessary. Without early intervention that involves AAC, quality of life can suffer for children with complex communication needs. This is why experts suggest a multimodal approach in therapy that focuses on communication, speech and language for children who are capable of producing natural speech. Thank you.